Hi, I'm Dr. Acar. I'm uro-oncologist. So Randy Miller came to me for take a solution of a difficult problem because he had the prostate cancer diagnosis for 4 years ago, and in these 4 years he tried to make any solution about it, but he didn't get any operation about it. After 4 years of the diagnosis, it could be sometimes a little bit late for the therapy of this illness, but we did some investigation about it, and we found it still a localized prostate cancer, not spread to the body, to the other organs, for example, and the bones. So we try to give our best with a uro-oncological operation with radical prostatectomy. So radical prostatectomy is choice of option with prostate cancer if it is a localized manner. If it is in the prostate, maybe in the lymph nodes nearly located in the area of the prostate area, made the prostate operation just in 3 days. You go from the hospital with a catheter, Did you have any pain, any much pain? What can you say after the operation? So I try to make always an operation like a medical therapy, for example, like a real painful thing. So I try to give my best in my 35th year of the urology. How can I do it very easy for the patient? How can I do it not to get any pain for the patient? I try to always. Did I get this success? Can you tell me something about it?
Minimal pain.
Minimal pain.
For the amount of work that you did and what you did, I would say it's minimal pain.
We did radical prostatectomy and regional lymphadenectomy added to the operation. It could be suspicious for the lymph nodes spreading, Therefore, it would be much better to make the lymphadenectomy with the radical prostatectomy. It makes the issue a little bit difficult, but it went wonderful, in your case. And if I see just after 1 week after the operation, so you are sitting here, you are seeing, so looking very good, So I'm just so happy about it. You know it, Randy?
You're the professional.
Thank you.
Mr. Miller, are you happy with the whole experience?
Very happy with the whole experience. Very much so. One of my fellow coworkers, his wife is from here, and they come here for medical, and that's where I got the idea, and I started doing some research, and here I am.
A lot of patients that are going through the same thing are quite concerned about coming to Turkey because of safety, or they don't know how the whole process will work out. We try to arrange everything for the patients, such as transportations, and we help them with the hotel and everything. Can you tell a few things about that for the patients who are going through their schedule coming to Turkey? Like, how did you feel when you get to the hospital? How was your whole experience in terms of feeling safe?
I wasn't sure what I was getting myself into. And when you come to another country, there's always a little apprehension. The cab ride from the airport to the motel, the scenery is different from where I come from. But once I got to the hospital, everything changed. Yes, I was nervous, and yes, I was concerned. And again, I'm in a foreign country I've never been to. I know very little about this country, and it's worked out very well. I would recommend anybody to come here for this, if they need this procedure.
So here's Liv Vadistanbul Hospital. So I worked in Zurich University for 2 years, Frankfurt University for 2 years, and several months in Basel University. So I know this German-speaking area very well. So I have also so many patients from abroad, from Georgia, from Azerbaijan, from even England, Canada, and US, and mostly all of the European countries. the most patient tell me that they don't have a hospital like this hospital in their country. This hospital has so capacity and capable on almost all the oncological therapies. For example, the focal therapy for example, I have a patient from Germany and a patient from Zurich for focal therapy of prostate cancer. They couldn't get this therapy type in their countries. So we can do robotic surgery if needed, we can do all open surgeries, we can do all focal therapies, all minimal invasive surgeries, laparoscopies in here. I have a team with 11 people here, all the nurses and all the staffs. So if anybody would have any problem with the urological cancers and BPH, you can find here opportunities of this therapy options, I mean.